Good afternoon, ladies and gentlemen. I want to thank you very much for giving me the opportunity to be with you by video. I'm very sorry I could not be there in person because of scheduling difficulties that made the trip impossible for me. I'm going to go through my slides rather quickly, but I will make the slides available to anyone who wants them. So let's get started. The topic of my discussion will be the role of biomedical research in ending malaria. As Lee Hall and I wrote about almost 10 years ago now, that biomedical research agenda is going to be critical in any attempts to control, eliminate, and eradicate malaria, as we stated and outlined in this paper in the Journal of Infectious Diseases. This aligns very well with the WHO Global Malaria Program, as shown on the right-hand part of this slide, which was followed up by papers in PLOS Medicine from the Malaria group, again talking about the importance of a research agenda for malaria eradication. And so I'm going to divide my talk into 5 major components, and I'll touch briefly on each of these. Obviously, I can't be complete in all of them, but we'll try to get the most salient points. First, and importantly, is the arena of diagnostics. We all know the importance of improving and refining our diagnostics, particularly with non-invasive sampling. One of the important issues is that in our endeavor to ultimately control and hopefully eliminate malaria, we will need diagnostics that have sensitivity and specificity, including in low incidence settings, which will be the scenario as we approach malaria control and eradication. These are some selected examples of novel diagnostics. I don't have time to go over each and every one of them, but as you can see on the right-hand side of the slide, they are in various stages of development, from preclinical to field testing to being cleared already by the FDA and other regulatory agencies. This is an example of a very recent one just a few months ago, which is a saliva-based rapid test to quantify the infectious subclinical malaria parasite reservoir. Moving on to therapeutics, there are many unmet needs for malaria therapeutics. We need simple, short courses. Obviously, we need to overcome resistance, which we'll get back to in a moment, to prevent and treat liver stage infection, including the prevention of relapse, as well as transmission blocking. Just a moment on the issue of overcoming resistance. We're all very familiar, and I know this audience is very well acquainted with this, with the ever-present danger of the emergence of resistance, including the spread of artemisinin resistance in Plasmodium falciparum along the Cambodian-Thai border. There have been a number of studies that are trying to approach this, including genomic epidemiological studies that are identifying the diversification of malaria into a number of subgroups and new genetic mutations leading to the spread from Cambodia to surrounding nations. One of the most exciting papers that we've come across is a recent paper about a year and a half ago in Science, in which saturation mutagenesis was used to identify almost 2,700 essential genes. And the reason this is important, which is, I believe, obvious to everyone, if you can identify an essential gene for the malaria parasite, that will give you numerous targets to overcome resistance to various anti-malarials. In addition, open source discovery of screening for more than 500,000 compounds has yielded a number of important potential hits that would inhibit liver stage Plasmodium species and would lead to molecules for next generation chemoprotective antimalarials. This is just a couple of examples of some of these published over the last couple of years, the tetraoxane-based antimalarials, as well as identifying the genetic mutations associated with ozonide susceptibility. Moving on to vaccines, there are key scientific challenges for malaria vaccine. Listed on this slide, limited choice of antigens, the problem with the predictive value of animal models, platforms to deliver multiple antigens, various levels of efficacy, the stumbling block always being the heterologous protection in the field that you might get from various vaccines. Durability is an important problem, as well as its utilization in conjunction with other control measures. The general approaches to malaria vaccines have been twofold, two broad umbrellas or buckets: subunit vaccines and whole parasite approaches. This is a schematic diagram, rather complicated, but it encompasses the multiple targets in the cycle of the malaria parasite, from the inhibition of merozoite invasion, the important point of the killing of infected hepatocytes, the inhibition of sporozoite infection, sexual stage development, and the prevention of infected red blood cell mediated pathology, particularly in the cerebral brain pathology of malaria. This is a rather full table of the clinical development pipeline. Again, I don't have time to go through each and every one of these. The one that obviously is the most advanced is the RTSS, which is something which, although it has really been an advance as far as the optimum vaccine situation, we still have a very long way to go. And the reason I put this slide in is that when we're talking about vaccines for malaria, we really still do much better than we are doing right now. Another interesting, somewhat different approach is immunoprophylaxis, as shown here on these two papers last year in Nature Medicine from Tony Lanzavecchia and Bob Cedar, in which monoclonal antibodies were used to define a new site of vulnerability on the Plasmodium falciparum circumsporite protein. This has really good promise not only for the prevention of malaria, but also in approaches at eliminating malaria in restricted regions, towns, villages, or what have you. And then finally, there's vector control. Obviously, we have our standard methods that you're all familiar with, mosquito avoidance, obviously, but there are some novel approaches that have now being used. And those include those shown here on the slide: biopesticides that target the mosquitoes only and not other insects, sugar-baked traps, novel chemicals and formulations, natural parasitic fungi, as well as the gene drive, which is being approached with some caution in various regions of the world. Here is an interesting paper from just a few months ago in which the mosquitoes are exposed not only to bed nets that have insecticide, but also bed nets that are permeated with anti-malarial chemicals. I want to close by just a couple of comments about the recompetition and now second round of the NIH-funded 11 International Centers for Excellence for Malaria Research. This map shows the geographic and global distribution of these centers. The important point of this is that we often talk in medicine about bench to bedside and bedside to bench. What these centers are essentially striving for, and I believe succeeding, in going from laboratory to field and field to laboratory, because as things change in the field, adjustments in the direction of research are made. This has been articulated in a science article from Elizabeth Winsler, in which it's entitled, as shown here, A Roadmap for Malaria Research, that there is still much research to be done if innovative malaria control and elimination methods are to be discovered and developed. And so in conclusion, since the year 2000, substantial progress towards global malaria control and elimination has certainly been made with the available tools. However, malaria eradication remains an appropriate long-term goal, but future progress may be impeded by the resistance to public health interventions. And recent research advances have laid the foundation for identification, development, and eventual deployment of novel interventions to ensure that eradication efforts remain viable in the foreseeable future. So once again, I want to thank you for giving me the opportunity to present this material to you, albeit by video, and I appreciate this opportunity. Thank you very much.